Hi, I'm Dr. Jenna Curtis from SUNY Cortland, and I'm here today to talk about the myth that a positive pap smear means somebody has cervical cancer. So lots of people are afraid to get paps because they don't know what the test is going to show and what it entails, and they're worried that maybe it'll tell them something terrible. The good news is that not only are paps super easy to get, but they actually help people prevent cervical cancer. So what happens when somebody gets a pap smear is their provider inserts a little tiny brush into the vagina and brushes some cells off the cervix. The cervix separates the vagina from the uterus, and it's a little closed channel that helps keep pregnancies safe from infection. So it's super important. A pap smear takes some of those cells, and then the provider is able to send them to a lab where they look at them under the microscope. They check to make sure the cells are healthy and normal. An abnormal pap means that some of the cells aren't growing the way that we would expect them to. That doesn't mean that somebody has cancer. 90% of abnormal paps, there's no cancer at all, just cells that we wouldn't expect to see on a healthy cervix. What happens then is providers make follow-up appointments to do other testing and to watch the cells. So if people get routine pap smears, it can actually prevent cervical cancer, because if we see that cells are growing in a dangerous way, they can be removed before they ever get cancerous. So not only do positive pap smears not mean that somebody has cancer, finding out that cervical cells are abnormal early helps people prevent cancer so they never have to worry about it.